no idea.
How do? This is Keep It Keto, and today's video I am carving up a good topic for you. Keto and lupus.
And what is this disease?
I'm going to explore the origins of lupus, and I'm going to explore its relationship with the ketogenic diet. Remember to give it a like, a subscribe, all that jazz. Let's get this channel growing.
Would you just get on with your point, man?
So, what is lupus, and who does it affect? Lupus, Latin for wolf, based on the wolf bite or the butterfly rash it causes, also called systemic lupus erythematosus, SLE. It is an autoimmune disease driven by the hyperactivation of certain T cells and B cells, leading to the production of antibodies that target the host's own antigens. The pathogenesis of SEL, let's just call it lupus from now on, is heavily influenced by genetics, stress, environmental, diet and immunological factors, which collectively render effective management very challenging. The predominance of lupus significantly skews towards women, with an incidence of 1 in 1,700, particularly those of childbearing age, at roughly a ratio of 9:1 compared to men. This suggests an interplay of hormonal and genetic factors that could exacerbate immune dysregulation associated with lupus. Women tend to relapse into autoimmune and/or psychiatric episodes, but men have more serious medical conditions such as kidney disease, serositis, which is heart and lung tissue inflammation, and higher mortality rates regarding lupus. All age ranges can be affected, but it mostly occurs between 15 to 45 years old. Additionally, ethnic background plays a pivotal role in susceptibility, with European countries showing lower incidence compared to Asia, Australia, and America. For instance, individuals of African, Asian, and Hispanic descent are statistically more likely to develop lupus. It should be noted that rates in the developing world are not clear, while incidences are likely associated with areas that contain more studies in this subject. In lupus, 95% of patients have lower than normal white blood cell, lymphocyte, counts due to their destruction by autoimmune antibodies. However, as more lymphocytes are released from the bone marrow, there are enough lymphocytes to fight infection. But this causes potential to affect multiple body systems, causing specific clinical indicators such as fatigue, skin lesions, joint inflammation, impaired kidney function, pericarditis, photosensitivity, and central nervous damage. Lupus affecting the skin includes discoid lupus erythematosus and drug-induced lupus, a reaction to certain medications that typically resolves upon discontinuation. The identification of lupus poses considerable challenges due to its heterogeneity and the overlap of symptoms with other autoimmune diseases. And, oddly enough, many lupus patients prior to diagnosis and clinical indicators can experience psychological symptoms such as depression, anxiety, insomnia, and even nightmares. With these psychiatric aspects increasing in severity just before lupus symptoms flare up. The frequency of obesity is higher in lupus patients than in the general population as well. And with obesity comes increased adipose tissue, and increased adipose tissue secretes pro-inflammatory cytokines, such as tumor necrosis factor alpha and IL-6. Increased adipose mass may then contribute to inflammation worsening and disease activity worsening as well. This inflammation can lead to a vicious cycle where immune dysregulation prompts further inflammation responses, complicating management strategies for individuals affected with the disease. Alongside TNF-alpha and IL-6, other cytokines such as IL-4, IFN gamma, IL-12, IL-10, IL-18 and IL-17 in plasma and serum are present in patients with active lupus. Whilst in healthy controls, the anti-inflammatory IL-2 levels are lower.
It will.
Though no cures are known to exist, researchers have discovered multiple molecules in the blood of people with lupus. Such molecules include the aryl hydrocarbon receptor, AHR, which regulates how cells respond to bacteria, metabolites, and environmental pollutants. AHR plays a regulatory role in Treg and Th17 cell development. When the AHR experiences insufficient activation, too many disease-promoting cells called T peripheral helper cells are produced. These T cells will then attack healthy cells. It has been found that activating the AHR pathway with small molecule activators or blocking excess amounts of interferon in the blood can hinder the production of disease-causing cells.
It'll do.
Little research exists between keto, for example, and interferons, but it promises to be a future line of investigation for lupus regression, and if keto can act upon such interferons. This video primarily focuses on the dietary aspect of treating lupus, so I'm not going to talk about the drugs, because drugs are bad, okay?
Yes, by all means.
On that note, speaking about dietary approaches, can they alone reduce or even halt lupus disease progression? Well, as always, do not take my information purely as gospel and consult your medical health professionals first. Basically, do your own research. Use what I say here as supplementary. Now then, this is keto and lupus, the good, the bad and the ugly. As of 2026 of this video, there still exists few direct lupus studies that involve, yet alone speak of, experimental treatment with keto and lupus. Nutritional interventions can play a significant role in modulating these factors, with recent evidence suggesting that specific dietary choices may mitigate inflammatory responses. Lupus patients are advised by nutritionists to adopt an anti-inflammatory diet, which tries to adhere to the notion of reducing inflammation to reduce autoimmune activity. Now, I'm a fair chap, so I'm going to talk about other diets, one of which is a Mediterranean diet, which with lupus may provide protective benefits. It may improve quality of life, and it may reduce disease activity through enhanced nutrient intake and microbiome health. Being rich in omega-3 fatty acids, antioxidants and fibre, it has demonstrated anti-inflammatory properties that may mitigate lupus symptoms, potentially improving overall health outcomes. Furthermore, the low-calorie, low-glycemic diets have shown promise in improving quality of life and lipid profiles among lupus patients, which presents a compelling argument for dietary diversification.
You have a brain.
Now on to nutrients, such as omega-3. Omega-3 intake may alleviate inflammatory responses and improve overall joint function, thereby reducing pain episodes. It is shown to significantly alter pro-inflammatory cytokine profile and gene expression, potentially reducing autoimmune activity in susceptible individuals and autoantibody production in spleen and kidneys. Complications such as plaque presence and dyslipidemia can result from higher intake of carbohydrates and lower consumption of omega-3.
Dismissed.
We mentioned earlier the relationship between lupus and obesity. This can also be explained by vitamin D deficiency and increased adipokines, which are secreted from fat cells, such as leptin, that can increase signaling in pro-inflammatory cytokines. Supplementation of macronutrients and micronutrients such as vitamins A, B, C, D, and E, minerals such as calcium, zinc, selenium, iron, and copper, and polyphenol-containing foods can produce an immunomodulatory effect in lupus patients.
Now here's the onion.
Now on what to avoid in terms of foods and nutrients. This includes garlic, echinacea, and alfalfa sprouts, with garlic, for example, containing immune-boosting compounds such as allicin and thiosulfonates. Whilst useful in normally active immune systems, this is advised against with lupus patients due to their already overactive immune systems. Echinacea's use in fighting colds and boosting immune activity has negative effects for the same reasons in lupus patients. Alfalfa sprouts contain L-carnitine, an amino acid that boosts B-cell production and thus is another potent immune stimulant. Alcohol, sugar, trans fats and saturated fats, of which I'll talk of later, are also advised against. Red meat and nightshade vegetables, think tomatoes, potatoes, peppers, aubergines, et al., also have advisory status, though their links to lupus and inflammation are not highly detailed. So I've mentioned Mediterranean diets, low-calorie diets, anti-inflammatory diets, and low-glycemic diets. A potential issue with all of these diets is quite simply their excessive consumption of carbohydrates in comparison to their benefits for people that suffer with lupus. People who have lupus have a higher risk for type 2 diabetes, often due to the autoimmune activity. For example, the damage against the pancreas, and when using drugs such as steroids, glucocorticoids and hydroxychloroquine, which can foster insulin resistance. Basically, utilising any diet that promotes high carbohydrate consumption, regardless of glycemic index rating, can increase glycemia, which then generates hyperinsulinemia. This can activate transcription factors that promote the synthesis of fatty acids and triglycerides, which are inflammatory by nature. The resulting triglyceride synthesis is also true when combining carbohydrates and fats in the same meals. Did you know that one? Fatigue is a common and debilitating symptom also associated with lupus, impacting daily activities and overall quality of life. Dietary changes, such as those involving caloric restriction, could inadvertently exacerbate energy depletion in vulnerable populations. Thus, while certain diets may confer benefits, their implementation must be critically evaluated to ensure they do not inadvertently worsen fatigue.
Look at the fucking state of you.
So, quick reminder on keto. Keto is characterised by beta oxidation, fat breakdown, of fats, and is a high-fat, medium or high-protein and low-carbohydrate intake diet. It has garnered attention for its anti-inflammatory effects, improved energy metabolism and mitochondrial function, and it supports weight management, with emphasis that dietary fat composition and caloric restriction could mitigate inflammatory responses further. Keto could also aid people in improving lipid profiles, which are often disrupted with autoimmune diseases.
It will.
So, the benefits of keto with its implementation with people that have lupus. Keto's main metabolite / immune regulator is beta-hydroxybutyrate, which has been seen to increase concentrations of anti-inflammatory interleukin-10. This also blocks NLRP3 inflammasome-mediated inflammation and maintains the balance between Th17 and Treg cells. Since imbalance slanted towards excess Th17 cells is an inflammatory facet of lupus. Beta-hydroxybutyrate also stimulates IL-2 production, which can limit T-cell responses to self-antigens by polarization of CD4 plus T cells into pro-inflammatory Th17 cells. Yep, it's a big mouthful, but hear me out here.
No idea.
Now then, on to the potential downsides of trying keto as a lupus patient. It is, ironically, the potential of long-term usage of keto that will actually promote inflammation. But hear me out, let me explain. When you use keto short-term, it shifts metabolism towards the use of ketones as fuel and promotes acute inflammation, which is actually useful as an initial immune modulator against infection. However, long-term keto usage is a major stressor in some people and can cause oxidative stress, which is a chronic inflammatory response. The long-term presence of dietary fats, mainly saturated fats and polyunsaturated fats, in large amounts can exacerbate immune dysregulation. The same isn't as prolific for polysaturated and polyunsaturated fats. Beta-hydroxybutyrate boosts CD8 T-cell function by inducing significantly higher expression of central immune cytokines and enhanced cytotoxicity. Basically, it stimulates immune activity. Large quantities of fats, long-term, can elevate Th17 lymphocyte counts and increase levels of autoantibodies. Naturally, these aspects are extremely useful in combating infection and activating innate immunity, but this isn't useful for lupus patients who already have excessive immune activation and thus may increase their already autoimmune response higher. Furthermore, the high fat content may pose risks, particularly for lupus patients with pre-existing liver conditions. Excess focus on fats may inadvertently exacerbate symptoms or lead to nutrient deficiencies. The nature of these effects is ultimately influenced by the amount and type of fat consumed. The role of various dietary constituents, including fats, on gut microflora and subsequent health outcomes in the host is another exciting and novel area of inquiry. I'm going to therefore speak more on the gut microbiome in relation to lupus and if keto has a positive, indifferent or negative effect on it. Previous studies have demonstrated the potential of keto to modify the diversity and species composition of the gut microbiota in individuals with various health conditions, including obesity, type 2 diabetes, cancer, epilepsy, and Alzheimer's disease, as well as in healthy individuals. The full potential of the microbiome to modulate the immune system is only now coming into full focus.
Say nothing then. It's often best.
Short-chain fatty acids produced by gut microbiota, especially butyrate produced by Clostridia, can promote the differentiation of Treg cells to suppress inflammation. Butyrate is produced by gut bacteria when they ferment fibre. Butyrate is essential in regulating immune response by controlling inflammation response and serving as the main energy source of gut epithelial cells. If you want more butyrate in your life, add butter to your diet, since it can facilitate butyrate production. Since butter, etymologically from Latin butrum, now you know, contains small levels of butyrate and butyric acid, two very closely related molecules in structure and function. The ketogenic diet can also induce the liver to produce beta-hydroxybutyrate, which is almost identical to butyrate except for one added oxygen atom, but again with similar gut functions. Regarding the human microbiota, Ruminococcus navis is currently the best documented pathogen implicated in lupus. It is one of the 50 most commonly found species in the healthy human gut microbiota. Emerging evidence implicates Ruminococcus navis in many other autoimmune and inflammatory diseases as well. In lupus patients with high clinical disease activity, patients who have an increased abundance of Ruminococcus navis in the gut also have high levels of strain-specific serum IgG antibodies. The presence of butyrate can suppress Ruminococcus navis activity. Now, the same has not yet been validated for beta-hydroxybutyrate activity on Ruminococcus navis, but the chemical similarities and modes of action could suggest that beta-hydroxybutyrate, like butyrate itself, can also suppress Ruminococcus navis activity. I'm going to talk about another bacteria in the gut, Bifidobacterium. It has been suggested to exert anti-inflammatory functions, with a greater abundance of Bifidobacterium in the gut associated with reduced lupus symptoms. Shifts in gut microbiota are associated with high-fat diets, and with keto, this can sometimes result in the loss of Bifidobacteria due to the antibacterial properties of regenerated ketones. However, with supplementation of butyric acid, as found in butter as said before, this can feed Bifidobacteria, increasing Bifidobacteria whilst maintaining the ketogenic diet. Overall, when it comes to keto and gut bacteria, especially in people with lupus, different types of ketogenic diets appear to exert varying effects on the gut microbiota species among subjects, highlighting the need for tailored analysis in specific contexts. So, the big burning question: can people with lupus use keto? This is a conclusion.
The ram has touched the wall. No mercy.
The best answer that I can give you is maybe, but these are my speculations based on current and limited evidence. And keto for people with lupus should only be attempted after consultation with healthcare professionals.
It'll do.
Weighing up both the potential anti-inflammatory effects of keto against its risks, particularly regarding long-term usage, should be assessed on a case-by-case basis, i.e. individuation rather than a collective approach. There appears to still be limited studies on keto and lupus, and trying to connect the dots between immune cascades and lupus has noted to me that there are no truly conclusive datasets. More rigorous, well-structured clinical trials are required to fully elucidate the implications of keto for those afflicted with lupus. Now, elaborated below are the findings of the studies. As always, don't just trust the science. And to also mind the pun, trust your gut, intuitively and intellectually. A few questions for those of you with lupus who have started keto. How does being on keto make you feel? Do you feel better? Do you feel worse? Is there no difference to your progression with lupus? Have you noticed more energy, less energy, more flare-ups, less flare-ups? Good and bad aspects at the same time? Either way, be your own researcher and test subject. Nobody knows you better than you. Lupus has a very variable nature, so individuated programs should be based on unique gut microbiome profiles in patients, the progression and severity of their lupus, their exercise level, food consumption, and macros, for example, attaining here to any of the keto diets out there, their sleep levels and their stress levels.
Dismissed.
So, should someone with lupus aim to undertake a keto regimen, I would recommend the following to trial for your own understanding. Number 1. A cyclical ketogenic diet to aid the potential reformation of bifidobacteria via occasional carbohydrate consumption, yeah, I'm saying that, to specifically promote butyrate production to potentially suppress Ruminococcus navis activity. 2. The replenishment of a microbiome preferable to lupus patients can come through the consumption of probiotics such as kefir, sauerkraut and kimchi. The consumption of butter may also prove beneficial, being a prebiotic. Number 3. Short-term usage of keto may be beneficial in promoting anti-inflammatory effects for a limited period, whilst long-term keto usage may promote pro-inflammatory responses, so plan accordingly. Number 4. Though currently few research papers exist on fasting and lupus, it alone and with keto may aid reducing inflammation, specifically NLRP3 inflammasome activity. Since autophagy is dysregulated in lupus, it can also correct its function, potentially reducing further inflammatory episodes. Number 5. Omega-3 based food intake and supplementation, no consensus on dosage, so follow usual guidelines, with access to lupus-friendly foods high in vitamins and minerals I labelled above.
I'd forgot you.
Number 6. Exercise appropriate to your fitness levels and potential for flare-ups. Number 7. Adequate sleep levels for recovery from any potential autoimmune activity. Number 8. Reduce stress. And number 9. Good hydration. And that's it, we're finished here. Let me know of your experiences with lupus, if you've tried keto with lupus, any positives, any negatives, and comment down below, subscribe and like, all that jazz. Remember, to know thy health and know thyself. Ta-da, and thank you.